Welcome to this explainer. Today, we're diving into a pretty fascinating problem in biomechanics and structural engineering, and it's one that takes place right inside your mouth. Think of a damaged tooth kind of like a compromised building. You wouldn't bulldoze an entire house just because it has a leaky roof, right? But on the flip side, you definitely wouldn't try to fix a completely collapsed foundation with just a little bit of spackle. You have to scale your repair to the exact level of the damage.
So here is the big question for us today. What happens when a simple filling just isn't going to cut it, but a full crown is honestly overkill? When a tooth's hard tissues are partially destroyed, whether that's from a carious lesion, a fracture, or just severe attrition over time, we need structural solutions that perfectly bridge that gap between a minor patch and a total replacement.
Here's our roadmap for today. 1. The Restoration Escalation. 2. Inlays, inside the tooth. 3. Onlays, covering the cusps. 4. Overlays, arch and root coverage. 5. Post and core foundations. And finally, 6. Making the right choice. Let's get right into it.
Number 1. The Restoration Escalation, assessing tooth destruction.
Okay, the absolutely crucial takeaway here is that our restorative solutions have to scale up proportionately with the severity of the tooth's destruction. The clinical picture completely depends on the size and the localization of the defect. We're focusing on indirect restorations today, meaning they're custom fabricated outside the mouth, often in a dental lab or using CAD/CAM technology. And the ultimate deciding factor for which one to use, it's exactly how much of that natural tooth architecture is missing.
Moving on to number 2. Inlays, inside the teeth.
So, what exactly is an inlay? Well, it's a fixed intracoronal restoration made outside the tooth that corresponds precisely to the form of a prepared cavity. Notice that keyword intracoronal? It literally means within the corona or sitting right within the confines of the natural cusps and contours of the tooth. We generally utilize these for minor to moderate-sized lesions.
As you can see here, the restoration sits safely inside the cusp tips of the tooth. The outer walls, those peaks of the tooth, are actually still structurally sound and intact. The inlay is just resting snugly within that prepared cavity, essentially acting like a highly engineered puzzle piece. Now, you might be wondering, why go through all the trouble of making an inlay instead of just packing in a regular filling? Well, on the plus side, inlays, especially when you're using ceramic or composite materials, are highly aesthetic. They look great. They're also conservative, meaning you save a lot more of the natural tooth structure compared to grinding it down for a full crown. They also give the clinician incredibly precise control over proximal contours to ensure exact border adhesion. But there's always a trade-off, right? Because they are indirect restorations, they generally involve increased laboratory fees, and unless you're lucky enough to have same-day CAD/CAM technology, they're usually going to require 2 separate patient appointments.
All right, let's step it up. Number 3. Onlays, covering the cusps. An onlay is a partial coverage restoration that restores one or more cusps and the adjoining occlusal surfaces. Before it's placed, the tooth is reduced just enough so that this onlay can completely reestablish the occlusal, or biting plane. You can basically think of an onlay as an inlay that's been supplemented with an occlusal veneer to handle far more extensive damage.
Take a look at this. Here we've got a tooth with a grossly decayed or broken cusp. The onlay actually physically replaces those missing cusps. We rely on these for severely atrophied teeth or extensively damaged posterior teeth with really wide lesions. In a case like this, a standard inlay just wouldn't have enough surrounding wall to hold onto securely. Let's make sure we have this distinction totally locked in. The fundamental difference between the inlay and the onlay really comes down to spatial geometry. The inlay is confined within the cusps. It actually relies on the surrounding tooth for protection. The onlay, however, scales up to cover the cusps, meaning it actively protects whatever remaining tooth structure is beneath it from the intense forces of chewing. Seeing them side by side is the best way to cement this in your mind. On the left, you see the strictly intracoronal limits of the inlay. It stays entirely in its lane right in the middle. On the right, you see the extracoronal cusp coverage of the onlay. It caps the peaks. Which brings us to number 4. Overlays, arch and root coverage.
An overlay, which is more formally known in prosthodontics as an overdenture, is a much larger removable dental prosthesis. It covers and actually rests on one or more remaining natural teeth, natural tooth roots, or dental implants. At this stage, we're no longer just fixing a part of a single tooth, we are utilizing whatever foundational structures remain intact in the jaw to physically support and stabilize a comprehensive, multi-tooth prosthesis.
Number 5. Post and core foundations.
Now we're looking at a true foundational emergency. A post and core is a foundation restoration used to build up enough tooth structure to retain a future artificial crown. The biomechanics going on here are just brilliant. You have a dowel, that's the post, which acts as the screw component, inserted right down into a treated root canal. Then you have the core, which is the retentive component built directly on top of that post to replace the missing bulk of the tooth.
Okay, this is actually a wildly interesting historical fact. Back in the 18th century, the father of modern dentistry, Pierre Fauchard, literally inserted wooden dowels into root canals to retain a crown. His logic? The wood would become wet from oral fluids, physically expand, and therefore massively enhance the retention of the dowel. It's a remarkably resourceful, albeit a bit primitive, application of biomechanics.
Thankfully, we have evolved way past the days of expanding wood. Once the modern post is secured in the canal and the core is built up, that combined unit behaves exactly like a freshly prepared healthy tooth. We've basically taken a decimated root and turned it into a strong, viable stump that is perfectly ready for the placement of a final, full veneer crown.
Fabricating a custom metal dowel core today is an incredibly precise, multi-step lab process. First, you begin with tooth preparation, removing all existing restorations, caries, and unsupported walls. Then comes the canal preparation. Next up is fabricating a super precise pattern of that canal space. That pattern is then cast into a strong alloy, and finally, it goes through finishing and clinical cementation. It's a highly exact, beautifully engineered procedure that literally forms the bedrock for a tooth that would otherwise be completely lost.
And finally, number 6. Making the right choice.
So, what does this all boil down to in the clinic? While severity dictates the mechanical possibilities, 3 combined factors formulate the actual treatment plan for a patient. First, the physical severity of the tooth structure destruction sets the baseline. An inlay simply won't work if the cusps are already gone. Second, the aesthetic requirements. Placing invisible ceramic restorations is a massive priority for patients today. And third, of course, the financial cost of the treatment. Balancing structural necessity with aesthetics and cost is absolutely the true art of treatment planning.
We've seen an incredible arc of innovation today, haven't we? As our materials continue to advance from Fauchard's expanding wooden dowels, all the way to today's highly advanced CAD/CAM ceramics and specialized metal alloys, we really have to ask ourselves, will we eventually reach a point in biomechanics where no tooth is considered too severely damaged to save? It is definitely a fascinating thought to chew on. Thank you so much for joining me for this explainer. Keep exploring, keep questioning, and I'll catch you next time.